Welcome to Black Health Matters. I'm your host, Darryl Armistead. This is a Howard University Hospital transplant support group session led by Dr. Clive Callender, who is a noted transplant surgeon and professor of surgery at Howard University College of Medicine. Let's join today's session in progress.
To we've always had the ability to dance and sing and do those other kinds of things, and that it's uh, especially beneficial for everyone to sing, even if you sound awful, even if you only do it in the shower. But I think it's one of the most important social skills is to be able to sing whether you sound good or not. So for those of you who 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 would like to sing but don't think you sound too well, they say sing anyway. So uh, and nobody likes your singing, it's okay, but keep singing.
My students say I sound like a trombone when I sing.
Uh, the other article was an interesting article. It talks about 11 science-backed tips to help you eat healthier. I think we do that most of the time anyway, talk about it anyway. And one of the first things they suggest is that you use vegetable and fruit smoothies rather than fruit juices. That's one of the first things they talk about. And then they talk about choose healthier proteins, whether they're the plant-based or even if they're not, because they talk about eating chicken and fish and yogurt and other things that are not red meats. They talk about eating more fiber so that you have normal bowel movements, etc., and how fiber is good for your health. And then, of course, they emphasize cutting down on ultra-processed foods, which we talk about almost every week, and emphasize the importance of whole grains as we talk about uh, brown bread and brown rice. And then they talk about avoid sugar sweetened beverages, and then Greek yogurt, plain Greek yogurt, which I've never tried, but maybe some of you out there have. And they say that eggs are very good. That we shouldn't shy away from eggs and cut out alcohol and try to cut down on your sugar cravings. And they say all of these, they identified 11 aspects of ways in which you could have a better diet. Uh, Interesting article which emphasized things that we talk about every Thursday. Any comments on any of those contributions? Hi, Patty. Welcome.
Sorry, I'm late.
Any comments on those? Any of those? Any of you who like to sing but can't sing?
we I do remember when my husband and I joined the choir at Liberty. I remember Carol telling us, come and sing anyway, whether you think you can sing or not. She used to say that all the time. Yeah.
Yeah, the social benefits of singing are immense.
Yeah.
Okay.
The other thing, Dr. Callender, is you said that singing doesn't hurt.
Right. It
Or
may hurt some ears, but they'll
doesn't
get
hurt to sing. That's what you meant to say. Because singing does hurt. It doesn't hurt to sing.
Yeah, I've heard some people who sing who it hurt my ears, but I got over it.
I noticed, Dr. Callender, that you're always quoting the post Um, is it any particular place in the post that you get
Yeah, they have a
articles?
health and science section.
Okay,
Used to be every Tuesday. Now it's starting next week. It's going to be every Monday. But they have a health
okay,
science section. Used to be
okay.
every Tuesday, in which they have at least 10 articles on
Oh,
health
all
issues.
right.
Some of
Yeah.
which we already cover in our articles that we find all over the place, and some are not.
I don't take the post as a paper, but I do have it electronically. It's on my phone.
Yeah, so on Mondays, you
Post.
starting next Monday, they have a
Okay.
health science section that goes
Mhm.
once a week,
Okay. Very good.
and they have some very excellent articles that many of which we cover in our articles, but sometimes they have some that are just particularly outstanding.
Okay. Very good.
Okay, if there are no other comments, let's start going through the number of articles that we've put together for you. Yeah. Well, this is an interesting article that talks about the fact that they're coming up. The Japanese have artificial blood, and we've had some talk about this before, but and they're getting to the point where it's going to be available, and but it's not ready yet. I mean, they're still doing research. As you know, they have been doing research on this for some time, but they've never gotten to the point where they can really have a substitute blood that can be used. We know about blood plasma and other things, and uh, that it can be stored for up to 2 years, up to 5 years if frozen. Uh, but this research is that they've done in Japan is identifying a product that may well be used to replace the need for blood transfusions. Well, uh, we've had some discussions of this before, but they have not actually panned out. So this is an opportunity for us to see if over time if this works out. But right now we still need blood, and we need people like John Buchanan to continue to donate so that so many lives can continue to be saved. But
Dr. Callender, this would this be given regardless of blood type, or are there any antigeneic components to it that could be cause reactions? Or I mean,
certainly not. But as I say, this is early experiments that in Japan that
mhm.
seem to be irrespective of the donor type because it's hemoglobin itself and not associated. This is the advantage theoretically that if you use this, you wouldn't need to worry about the blood type. But we'll see if it pans out. We've been talking about this for the last 5 or 10 years, but the progression of it has never gotten very far. So we'll see what happens. But it's nice to see that uh, still working on it. But as of today, we still need people like John Buchanan to keep donating. Uh, okay, let's go to the next article. John Buchanan, any comments?
Yeah, I'm trying to imagine how this structure that they're developing, hemoglobin vesicles, can interact with the cells in the body, carrying the oxygen and all the nutrients that the cells need. That's hard to imagine.
Well, you see here it says the hemoglobins lack ABO and Rh antigens, so therefore you don't have, if you had that, you wouldn't have to worry about the blood types, theoretically. But time will tell. We'll see.
We will.
Yeah. This is an interesting article that talks about, we've talked about stroke prevention for the last couple of weeks, and it's ranks as the fifth leading cause of death. But what they're concerned about is that it's still fifth leading cause of death and disability in the United States, second worldwide, in spite of all of the information we have about taking care of high blood pressure, diabetes, and atrial fibrillation. And so you would have thought that would have cut down the number of strokes, but it suggests that we're not properly controlling blood pressure, which is quite evident that that is the case. And so while 80% of strokes can be prevented, they say, they still occur and they still are related primarily to untreated, improperly treated and undiagnosed hypertension, which is the biggest problem. And therefore, if one had hypertension and had it controlled, the likelihood of at least hypertensive strokes would be markedly reduced. And since they haven't been reduced, the question is, what else can we do? Darryl?
Yeah, I saw an article this week that was linking the increase in strokes and heart attacks to microplastics.
Oh, okay. Yeah, well, and there have been a number of articles that have said the same thing that you just mentioned about microplastics. And as we know, that is something that we are just becoming aware of. And there's little research in terms of how we're going to decrease the microplastic avalanche, which seems to be coming more and more.
Oh.
Any other comments about this stroke and how we can prevent getting strokes and how we can manage our diabetes, manage our hypertension, keep our lipid levels low, and thereby reduce the likelihood of strokes and, of course, of atrial fibrillation. We have ways of medications that help that as well. The use of statins is thought to have gone a long way
Yeah.
to help this, but still it proceeds. Darryl?
Yeah, last week you mentioned that TIAs, the mini strokes, the transient ischemic attacks, are a precursor to a full blown stroke. And a lot of people don't realize that they've had a TIA or a mini stroke. You know, the symptoms are that, somebody will say, well, I just got lightheaded and I was resting my eyes. I didn't pass out. But to the observer, it looks like they passed out even though they're sitting up straight. And, if you have any of those symptoms, you might be experiencing a mini stroke. And, it's not a one off. You'll experience more of them over time, and it could result in a full blown stroke later on.
Yeah, there's a lot of evidence that if you had a ischemic attack or mini stroke, as you talk about it, that it will result in full-blown stroke if you don't go and have it tested and try to find out what is the problem. So it's a very important point that you're making, Darryl, and thank you for bringing it up. Any other comments? I saw
I had a question.
John Buchanan.
Yes. My question is how can you explain how they can in the scan how they can tell that you had a stroke or a mini stroke?
Yeah, just look for the circulation in the brain. Uh, if you have bleeding, you get a CAT scan and it shows that there's blood in the brain. Or if you get a MRI or CAT scan, it will show where the blood supply to the brain has decreased. So that's how you can tell if you didn't already have the symptoms that you've had a stroke. So that CAT scans and MRIs can diagnose strokes very easily. Uh, John Tatum and then Darryl again.
Yeah, my question is the prevention of strokes. Um, the medicine different from a person who's trying to prevent strokes opposed to a person that has already had a stroke?
Very different,
A
like
very
night
different
and day.
medicine.
Because if you had a stroke, that means that either you have a clot in the blood vessel or you're bleeding in the brain. And so it's like night and day. So the prevention, therefore, is worth a pound of cure in that you prevent the blood clot from forming in the brain and blocking circulation. And having blood pressure control prevents bleeding in the brain, which uh, also damages the brain as well.
And so they recommend statins for which side of the fence?
Statins and control of your blood pressure, control of your diabetes,
Oh,
all of those are ways of preventing strokes.
thank you.
Darryl and then Lucy.
Yeah, my understanding is that a TIA may be harder to detect. Uh, MRIs can detect it within 24 hours, but the problem is that if it's a small clot and the clot dissolves in your brain very quickly, because sometimes it can dissolve within minutes or less. And so, like say, if you go to the hospital with a TIA and you're no longer symptomatic of a stroke, um, unless they take it a step further uh, with the MRI or another test, the doctors may miss a mini stroke. Is that correct?
Yeah, that's right. That's true. Yeah. But if you've had one, it suggests that you'll have others, and therefore it's still important for you to go to the hospital and be tested to find out whether or not this is indicative of a condition that you have that will result in a major stroke sooner than later. Dr. Perez?
Going back to an article that we had last week about the connection of mental health and cardiovascular disease, and the fact that we know the impact of hypertension specifically on strokes, yet so often the component of mental health is missing. The status of one's health is missing from the article or from our perspective.
And your comment or question is what? What's your point, Lucy?
My point is that we continuously see the impact of mental health on cardiovascular disease and specifically hypertension. Yet we never connect it when we're looking longitudinally at our studies.
Very good point, and that's something that we should change. And that's your point. That's a very good point.
Too early to go out.
John Tatum?
On the deck yet.
Yeah, my question is
Come on.
when you have stents put in, that's on the prevention side. Is that correct?
It's too
No,
early to go outside.
no, that is not prevention. That's treatment.
And I can't.
Got it.
Yeah, in other words, you already have a blockage, and that's bypassing the blockage. That's why you have a stent put in because you already have a blockage, and the stent is to bypass the blockage. So that's treatment. That's not prevention.
Okay. One's is some people have several stents, so that means they've had you have a stent for each uh, blockage that you've had.
That's correct. Yeah. And some people have as many as 3 to 5 blockages. Okay, let's go to the next one. Next article. Oh, this is a very important article pointing out something that we've mentioned recently, and that is we now have treatment for uh, fatty liver disease, steatotic liver disease, fatty liver disease. At one point, we didn't have much treatment for fatty liver disease. Now, with the new medications, we now recognize that we can treat fatty liver disease by managing the diabetes, by managing the obesity, by looking for fibrosis. And if you have fibrosis, to use some of the new drugs that we've talked about that now are able to treat uh, fatty liver disease. In the past, there was no treatment for fatty liver disease, but now with the new medications, we now uh, emphasize, of course, to stop alcohol consumption, but and managing the obesity, the hypertension, the diabetes, and the hypercholesterolemia is part of the management of hepatitis. But uh, much of this now is as a consequence of the new medications, the GLP-1 drugs that now have been shown to reverse uh, the fatty liver disease, which in the past, actually, there wasn't very good treatment for it. All we did was ask you to better control your diabetes and lose weight. But now we have GLP drugs that actually reverse uh, the fatty liver disease that formerly was not treatable. Any comments on this? Because this now means that, and formerly, if you had that diagnosis, there wasn't much we could do about it. Now we've got a way of treating. We call it MASLD now instead of fatty liver disease and steatotic liver disease, but it's the same thing. And we have ways of identifying fibrosis or scarring in the liver by ultrasound and other non-invasive tests, which we didn't have before.
Dr. Callender, you just said it, but I wondered if you could explain a little bit more about the fibrosis. What is that? And
Scarring. Uh, Whenever you have whenever you say fibrosis, you mean you have scarring, and scarring is a consequence of any any inflammatory condition that kills the cells. And when it kills the cells, you then get scarring or what is called fibrosis. And when you get fibrosis, usually that means the end. But of course, now with the new treatments, we are able now to, even if you have some fibrosis, to be able to reverse the liver disease that formerly was untreatable.
there is a point where it is irreversible, though.
Yeah, there's a point of irreversibility, especially if you diagnose it early, you can use these treatments. But if you wait too long, it gets, if you have 90% of the liver is fibrosed or scarred, then you're going to need a liver transplant.
I see. Thank you.
Okay. Any other comments or questions? If not, this is good to know that just because you got fatty liver disease doesn't mean that you're going to need a liver transplant, especially if you catch it early. And the semaglutide is the GLP-1 drug that has shown benefit, but there are others. Now, this is an article that talks about the importance of taking care of diabetes by addressing lifestyle interventions, emphasizing sleeping, uh, controlling stress, proper diet, physical activity, avoiding tobacco and alcohol, and having social connections, emphasizing not only the diabetes care, but the all of the conditions that contribute to uncontrolled diabetes. And so in the past, just as Dr. Perez mentioned with the uh, cardiovascular problems, uh, omitting the mental conditions that make things worse. With diabetes, all of these other things make the diabetes worse. So if we include all these things that they mentioned, proper sleep, trying to get 8 hours, at least 7 to 9 hours a night, aerobic, aerobic and muscle strengthening activities, and then healthier diet with plant-based effort, uh, eliminating alcohol, tobacco, and the so-called recreational drugs. And then the cognitive behavioral treatment, the mindfulness, and uh, uh, and then of course incorporating the psychological needs into this becomes just as important as it is with the conditions we just talked about. So yes, the pharmacological aspect of it is important, but so important also is the rest of it. Okay. Any comments on this? I think that in many ways this is not dissimilar to what Dr. Perez talked about with the cardiovascular disease. Buchanan?
Yes. Are there any studies um, relating the health, the social health or the psychological health of the patient? Um,
Many. There are many that demonstrate that, and that's why you have this article, because there are many uh, studies that don't talk about it. They just talk about the management of the diabetes with insulin, but they don't talk about the other aspects of the care. But there are many studies now that demonstrate that it's taking care of the whole patient that matters, not just strictly the diabetes, but the entire patient.
Now, I think that's the same with a lot of illnesses. If you get diagnosed with cancer or something, that's the first thing I'm thinking, that everybody's going to be woe is me, get depressed and all this stuff. That could definitely affect your recovery. I mean, if depression can have an effect of your physical as well.
Very good point. Okay. Any other points you want to share? Yes, Patty?
I just wanted to say, I think type 2, I think diabetes is one of the most difficult conditions to manage for not only the patient, but the practitioner. There's so many things you can't do, and so many, I mean, it's really a life-changing event, especially type 2 diabetes for people. And following a restrictive diet and exercise plan, I think people generally don't do that, and it ends up hurting their health overall. I don't know if how many support groups and things like that are available for people with diabetes, and if they would even go. But I think to somehow, when we talk to people with diabetes, there's so many restrictions. I think they can't get past that. And I think it's somehow harder to manage even than a lot of cancers. And it's something they're going to have to live with for the rest of their life. And it requires really restrictive changes in their lifestyle. And it's not always easy, and easier for some than for others. But the ones who don't follow the routine quickly run into difficulties. So I don't think we, as a healthcare provider, I don't think we always recognize that we tell them what they can and can't do, but it's such an impact on their day-to-day existence. I think that's makes it very difficult.
Yeah, I think of all the diseases I've treated, to see the devastating effects of diabetes has been most uh, disturbing to me than probably anything else. Darryl?
Yeah, I've seen an ad that's been run very frequently lately. By lately, over the last month, I've noticed it, but it's an ad saying that medications don't work for black people. And it's, like if you click a link, it'll tell you, well, we've got the cure, something that'll work for black people. But, uh, the downside of that, of course, is I don't have diabetes, so I'm not likely to click on an ad. But there's a lot of people that do have diabetes that might stop taking their medications because now they're getting the impression it doesn't work.
Dangerous, very dangerous, very dangerous. Thank you for sharing. Hmm. Got enough problems to add that to it. It's kind of sad. Betty Blaylock?
Yes, I saw in the article about the work schedule, especially shift work. If someone is working, does that mean if you're working at night or that you don't get the proper rest, that you're more likely to get diabetes or?
Well, I don't think it means that. I know that people who have different shifts do have trouble getting proper sleep, and that makes it easier for them to develop all kinds of diseases, including diabetes. But I'm not sure that we've done any studies that uh, associate diabetes or anything else with shift changes. But the shift change, those people who work at night do have a different set of circumstances because the whole basis of metabolism is based upon you being active during the day and resting at night. And so
Mm,
that disturbance is something that is problematic to the whole body.
okay, yeah, because I definitely was a night worker for 30 years, but I got sleep, but it was usually broken up.
Yeah. So it is a concern. It is
Okay.
any other comments? If not, go to the next.
Oh, I'm sorry about that.
I'm sorry, I had a quick question. Betty just reminded me. Uh, Early on in my career, I was working during the day and also working at night, and I would have to uh, get home from school and take a nap, and then after playing till 2 in the morning, getting home and taking another nap. If those two naps added up to 7 to 8 hours, was that okay?
Well, it's interesting. We're gonna encounter an article that talks about napping, and I don't know the answer to that question, but I don't think anybody else does either, because there haven't been a number of articles that have identified that. And when we see the napping article, you'll see that they they don't they don't uh, put together anything. They just say that people who take naps, long naps, more likely to die. But they don't go into any detail on that. So the answer to that question remains to be seen. Let's go to the next article. Well, we have a lot of tests nowadays that are supposed to predict heart disease, and this is an article that suggests that there's so many aspects of heart disease that it's hard to uh, identify a novel biomarker that definitely means that you have heart disease. The many studies that we have that we use, but of course, I think the ones that are the most beneficial are those that identify calcium in the coronary vessels. And there are a number of studies that do that. But in terms of a blood test that really helps, and we've had a number of tests that we have thought would be helpful. But when push comes to shove, it turns out that most of them are not as helpful as the echocardiogram and the actual identification of actually arteriosclerosis in the blood vessels. And of course, we have the cholesterol panel that's supposed to help for that. And they're helpful to some degree, but not an awful lot. Dr. Perez?
Along with these biomarkers, and given our present administrations, the risk that they put into the science, ethics needs to go along with our biomarkers so that it is, and our personal information is not used in a negative sense against us. Just as Obamacare eliminated um, prior medical conditions from people being excluded from insurance, biomarkers that identify certain things that, even though knowing it will help us in preventing or beginning intervention early, it can also be used as an indicator for isolation or a higher insurance premium. So ethics, especially as it relates to people who have not had access to good health care, needs to be considered and advocated for.
Right, because this can be used dangerously if you thought that these BNPs and other tests that were thought were biomarkers that were thought to predict heart disease uh, were used against you, that would be awful. And that could happen if you have an administration which focuses on these rather than the real tests of whether or not you have heart disease or not. Let's go to the next article then. It's interesting that one of the things that Trump is trying to do is eliminate all of the benefits of Obamacare, which have been positive in all aspects of health, from end organ failure to everything. You see its impact on people of color everywhere, and people of all kinds, whether it's people of color and people who are not of color. Its benefits uh, are there, and eliminating it is will have dire consequences for all people. This is an article that says that it's a time to start looking for heart diseases at the age of 25. Of course, I really think that it should be from the age of 10 because that's when hypertension starts. But uh, anyway, these are the Manchester group suggesting that you should start really looking for it at the age of 25, not 40, but at 25. Uh, and I don't have any problem with that, except that I realized that people of color start having problems with their cardiovascular systems much earlier. And I don't think the age of 10 is too young.
I just saw an article late last night. A 10-year-old died from a heart condition. He was an athlete. He had pitched a baseball game and won the game, and the next day he died from very serious heart condition. And they knew, I'm pretty sure they knew that he had this condition, but looking for these risk factors early That seems to, as you suggested, seems to make a lot more sense.
Thank you for sharing. Okay. Um, yeah, and I just think that 25 is a little older than I think they should start. Uh, I think 10 is probably more like it, particularly with people of color. And here they're saying that 25 is a little bit too ambitious, but I don't agree. But anyway. Yeah.
What about those athletes like Bronny James? Weren't they diagnosed earlier with these, or did these difficulties just arise
Well,
when
I think if athletes at all ages were had EKGs and other tests of the heart, you may be able to make earlier diagnosis and prevent some of those sudden deaths that occur. Especially Bonnie James, whose condition was treated surgically. Uh, so if that had been diagnosed earlier, he might not have had the arrest that he had. But the problem with all of that is that you're talking about something that then becomes expensive. And nowadays, that's what people are running away from. Any other comment? If not, we'll go to the next article, please. This is colchicine is the treatment of choice for gout, but NSAIDs have been used. Those are non-steroidal anti-inflammatory agents have been used for some time uh, for gout. Colchicine has its side effects, which make it not so desirable. NSAIDs have less side effects, but the studies are suggesting that these NSAIDs have a more likely association with heart disease. And so that this article suggests that you're better off with drug like colchicine because it doesn't have that side effect or adverse side effect. And MACE is are the cardiovascular risk factors. So if you got gout, colchicine is treatment of choice. NSAIDs do good at the symptoms, but they also expose you to some other adverse circumstances. And colchicine is not fun either, but it it does the job. Betty Bella?
Yes, you're saying whatever the medicine for gout, the it starts with the A. It was at the beginning of the article. Is that
We're comparing colchicine, which is the treatment of choice for gout, with non-steroidal anti-inflammatories like Motrin and those kinds of drugs, which eliminate the symptoms very well. It's just that these NSAIDs also give you a greater risk for cardiovascular complications.
okay?
That's what
So
this article is showing, that
what
the
are the
risk,
ends?
the risk for adverse cardiovascular events is greater with the NSAIDs. And so they're suggesting that we use colchicine instead.
Okay, because I know my husband takes the medicine that starts with the A, the very first one up there. And
Allopurinol?
yes,
Yeah, well, of course, that's a that's the treatment for gout anyway as well. Colchicine and allopurinol are both
okay,
treatment for gout. That in contradistinction to the NSAIDs, And allopurinol is not an NSAID,
Okay.
right? That's the second choice of treatment for gout would be allopurinol. Yeah.
Oh, so what would be the first is the NSAIDs? Is that what you
No, the
said?
first is colchicine.
Colchicine.
Yeah. Colchicine and allopurinol are okay, but this
Oh,
article is saying the non-steroidal drugs are not okay.
okay. Okay.
So if you take colchicine or allopurinol, that's not a problem. But
Okay. That's getting ready to say he's been taking it for a long time.
yeah, allopurinol is a treatment for gout, prevents gouty episodes, just
Oh,
like colchicine does the same thing.
okay.
Any other comments or questions about this? We'll go to the next one. Darryl?
How long can a gout attack last?
That's an interesting question. That pain is so bad that most people get medicine for it, but it lasts until the uric acid goes down.
Okay, the reason I'm asking, if you're having a gout attack and say, the simplest thing to do is go to the drugstore and get some Motrin, which is an NSAID.
Right, that's right. It is,
Right.
it is, it is, and it relieves the symptoms of gout, so
Yeah.
that it's
So,
something that people are doing.
so
It's
people are
just
going to take the
saying,
Motrin.
yeah, but this is saying that the consequences of Motrin are more than the consequences of allopurinol and colchicine, although I've seen dire consequences to everything, including allopurinol. But the risk with the Motrin seems to be greater than the risk of the colchicine and the allopurinol.
So I'm thinking
Janice,
if
I'm
a
sorry,
gout attack,
Darryl.
I'm thinking if a gout attack lasts a week, people are going to take Motrin for a week until the symptoms go away,
Well, it
which is,
works. It works. It's just
yeah,
that it exposes you to other cardiovascular complications.
yeah. But if it lasts a week may be too long to be taking Motrin.
Well, after a week, it goes away. Yeah, I mean, if the gout, if you've taken the Motrin for a week, then the gout is going to be gone because your gas will be down. Usually, the acute gout symptoms occur within first 72 hours, and that pain is just unbearable, right? So you need to take something, but and so Motrin, you can get it started, but uh, allopurinol or colchicine are the treatment of choice, really. Janice,
Yes. Is gabapentin a medication for gout?
is what?
Gabapentin. Gabapentin.
No,
Uh-huh. No.
no, that's treatment for many things, but not for gout.
Yeah. I went to a doctor once and he talked in terms of neuropathy, and the neuropathy can turn into gout. And
No, 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 no. Neuropathy does not turn to gout.
okay, good.
Sorry.
No, it doesn't.
Betty Blaylock?
Is there any kind of shot that they can give you if you forgot?
No.
No.
So you can get a shot if they put you on that way.
Um,
What are the side effects of colchicine?
Oh, you get diarrhea. Um, that the main one is diarrhea. Yeah. You can get colicky pains and diarrhea.
Yes.
John Tatum?
Yeah, I've had gout, and everything you said is absolutely right. I when you have gout, that pain is so bad that they actually compare it to childbirth.
Yeah, right.
That
That's
is,
right. They do. Compared to childbirth, it's bad. Yeah, my wife had it also, and it's awful. The pain is just awful. Yeah.
yeah. And the other thing too, if you land in the bed on your back, uh, you can't even have the sheet
I remember.
on that toe. That toe's got to be out from under the sheet.
I remember my father had it, and when he had those gout attacks, the sheet could not touch it. It was just
Right.
that painful. He would scream.
Right.
Yeah, yeah.
Yeah.
But
Okay.
we're getting back to the point, though. Uh, I took colchicine, and my father had it. He took allopurinol, but the pain is so bad. We wanted the gold standard. We didn't want no NSAIDs.
Yeah, yeah.
The NSAIDs, they might help you out a little bit, but it depends on your pain. Now, you're gonna go right to the doctor. You're not gonna mess around. That
But
hurt.
like Darryl said, a lot of people just run to the drugstore and get Motrin.
Yeah, no, no, thank you.
Yeah. Okay, let's go to the next article. Oh, Carol, you had a comment?
Yeah, which one caused you to go to the restroom?
Colchicine.
Ultrasound.
Yeah.
Oh, okay.
You
Is that
stayed.
how it does? Is that how it cures you by cleaning you out?
No, but that's just a side effect of the medicine.
Oh, oh, okay.
Okay. All right, let's go to the next article then. Now, this is an article that may be attractive if you metformin, which, as you know, is the treatment for diabetes, is also reduces miscarriage if you have polycystic ovary syndrome, which is not a very common disease. But if you have it, it can cause you to have miscarriages. And so that if you are pregnant, uh, it's important for you to continue to metformin so that you don't get a miscarriage. I don't know how it's not gonna affect this group of people, but your children or grandchildren would keep this in mind if they are diabetics, that they have to be sure not to stop the metformin because miscarriages are more common if you stop the metformin.
Interesting.
Yeah, it is interesting. I wasn't aware of this before, so this is a new study.
I hope that goes out to a lot of the obstetricians in the country. I'm sure
Yeah,
they've seen it.
yeah, I'm sure they have. But,
It might be an indication that we're seeing more diabetes in younger women too.
Mm-hmm. True.
okay. Go to the next article. This is an article that encourages discussion because continuous glucose monitoring is now available for all, but we haven't really thought about it for treating early diabetes because it seemed like much ado about nothing. But this article is suggesting that that's the time to treat early diabetes and find out what is happening to the blood sugar so that you don't get the complications of diabetes. As Patty DeLone had indicated, it's a disease which, if it's not taken care of properly, will cause you endless complications, from going blind to losing your feet to losing your uh, kidneys, losing your heart, losing your brain. So that what this article is suggesting, by early monitoring of the blood sugars by continuous glucose monitoring, that you can prevent a lot of this activity. And I've never seen anybody suggest this before. And when I first read it, I wondered if this was too much, but I'm considering what diabetes can do to you. It probably makes a lot of sense to do it early rather than later. Any comments? Because this is a very interesting thought that I hadn't read before.
Dr. Callender, how much do they cost, the monitors?
I don't know what they cost. I know that nowadays that's the state of the art, so that most people are doing it for uh, much of all of the type 1 diabetes. For type 2, it's not that common uh, because people are using insulin, and some people are just using pills. So I'm not. It seems to me that most people have not used continuous glucose monitors for type 2 diabetes. For type 1, yes, but not for type 2. Dr. Perez.
I think it should be available to everybody. I used it for 2 years, even though it under Obamacare, it should have been covered for Medicare, but it hasn't been unless you are using insulin. But in terms of mental health, in terms of being in control of what you eat, knowing that your blood sugar is at a particular level, and deciding to get up and walk or deciding to have water instead of juice or tea. I mean, it really puts the control, a lot of the control in your hands. And what things trigger things like pasta doesn't raise my blood sugar as much as rice, and I love rice. But these things are things that you can then learn about yourself. And if you have good mental health, then you can institute strategies that keep you healthier.
Thank you for sharing. John Tatum.
Yeah, thank you for sharing that too, because um, those are ideas that people who have pre-diabetes can use.
Yes. Mhm. Okay, Darryl.
Yeah, white rice and brown rice do raise blood sugar, but black rice typically does not raise blood sugar levels.
Okay. Any other comments?
It costs about Costco's is the cheapest, which I think you can get for about $110 a month. Otherwise, it's about $150 a month.
Is that the monitor you're talking about?
Yeah, that's answering your question. Right. Okay, thank you very much. Let's go on to the next article.
One last question. They have so many different types of glucose monitors. Some are attached to the surface of your body, and some are internal, and some, you just stick yourself your fingers.
Okay, let's go on to the next one. Now, this is interesting because diet drinks and saccharin are thought to be the way to avoid diabetes, but in point of fact, they're saying that these two elements are associated with increased diabetic risk, which is not new, but something that is important to share. And it's been interesting over time to see how diet drinks and saccharin, which are done to try to address the fact that you can't get sugar, that they are also tied to increased diabetic risk, which is important to know about. Although that's not going to affect the uh, diet drink population because they continue to do it anyway. But it's important to let people know that these so-called remedies for diabetes uh, may be part and parcel of an unhealthy associations. Any comments or differences of opinion regarding this?
I think that ever since those sweet substitutes came on the market, there's been questions about this. So I remember when all of them first started years ago, there were always questions about whether they were good for you or not.
Yeah, yeah. Okay. Lucy, Dr. Perez?
And I guess that's why this group is so important, because we can begin to eliminate those choices when we have barbecues, when we have refreshments, and then people begin to have, salsa with, natural juices, a little squeeze of orange and lemon. We have to be the environment that promotes our health.
Thank you for sharing, Janice.
I agree with Dr. Perez. These group sessions, always something interesting. And I am a sugar substitute person, always thinking about weight. I'm not going to have the sugar. I'm going to do the sugar substitute like it's going to allow me to lose 10 pounds or something. I'm a coffee drinker. Now, Dr. Callender, I just put a little regular sugar in it, no more of the Splenda. So I'm listening.
Okay. Any other comments? If not, let's go on to the next article. This is an interesting article. It talks about a transepidermal water loss non-invasive tool that can tell whether diabetic ulcer is really healed or not. And if it's not really healed, then one should be very careful about it. This is something that the eye cannot see, but that this non-invasive tool can pick up. And with diabetic ulcers, it's important to know whether it's healed or not, because getting ulcer recurrence and getting infections from ulcers can ultimately result in amputations and those kinds of things. So it's important. Darryl?
Yeah, I'm sorry. My comment was back on the old article about the artificial sweeteners, and that's the opposite of sweet is bitter. And so my suggestion is when you embrace the bitter, like coffee without sugar, and you learn to like it, what'll happen is you start to kill that sweet tooth, because once you get used to embracing the bitter, what you thought you liked being sweet, it becomes too sweet. You can't stand it.
Thank you for sharing, Darryl. You've tried to educate us about
I
that
agree.
many times.
I agree because I went to the sugar sweetener due to our conversations here. I'm trying to get off that, and I started using sugar. But you're right, Darryl. Regular sugar now seems too sweet, so I'm using less and less. Thank you, Darryl.
Okay, thanks for sharing. Um, let's go to the next article. This is an article that kind of illustrates a point that social withdrawal and aging is tied to shifts in brain networks, which uh, leads to brain slowing down. And this is one of the reasons why social activity and interchanging in groups like this and others that have social connectedness become very important to keeping brain health. Darryl?
Please don't send this to my kids, Dr. Callender. They're nagging me all the time since I retired.
Darryl?
Yeah, social withdrawals can start with hearing loss.
Mm-hmm. Yep.
So I know that John Buchanan is had his new hearing aids for about a month. So how's it going, John?
I'm really surprised at how much I hear now, especially the upper frequencies. But I'm also ashamed about uh, how loud I was when I got angry. I, I can get angry quieter now.
Well, one of the things that surprised me was that the number of people who have hearing impediments who don't wear hearing aids. And most men who have the hearing impediments do not wear hearing aids because there's a stigma associated with wearing hearing aids. And so, uh, and when you first start using the hearing aids, you look around and you see you're the only one, and you kind of feel kind of stigmatized. But it's in your own best health interest in uh, preventing Alzheimer's and other things that you need to do it. Also for your friends, so you can hear them. Darryl, your hand's raised.
Yeah, I got a buddy who's going through a divorce right now, and he had a hearing test, found out that he had about a 50% hearing loss. So he says, well, I'm afraid that if I get a hearing aid and I'm back in the dating pool, that it'll be a turnoff. And I said, no, hearing aids don't turn women off. What turns them off is asking them to repeat themselves and talking too loud.
That's right. You're so true. You're so right.
I agree with that 100%.
A good one.
What did you say? Huh? What? Huh? What?
Betty Blaylock.
Yes, I just listening to this discussion. I definitely, if I had a hearing impediment, which thankfully I don't so far anyway, I would definitely use my hearing aids because I'm nosy and I want to make sure I hear what's going on.
Love it.
That's another point of view. Thank you for sharing, Betty. Okay.
The other thing, that guy that's getting divorced, it might be because he has not been able to hear his wife too well.
Well,
And now that he can hear,
catastrophic because
yeah, now that he can hear, he
you need to hear your wife
hasn't made a mistake.
because that's your best friend. Should be your best friend.
If you can't hear your best friend and you get divorced,
Joyce, were you saying anything?
No, I was
Okay.
just shaking my head.
Okay.
No.
Okay. All right. Okay, let's go to the next article. This is not something that's surprising to us, but also Alzheimer's disease and the related dementias cause an incredible burden for minority communities. And that's not a surprise. And I think we discussed this, I think, when John Buchanan was away, because the importance of these groups that help support patients with Alzheimer's by having group uh, places where they can go, and it helps out in many more ways than one, because one person alone cannot take care of an Alzheimer's patient. And if you try to do that, you have two patients who are in need. And so this burden can be lessened by relying on those social groups that will actually take your loved one for 3 to 4 hours a day and help take the burden off of the family members who would otherwise wind up being sick themselves as a consequence. Any comments from those of you who've had uh, relatives and friends with Alzheimer's who are able to take advantage of outside sources that were able to relieve some of the burden on families.
Well, I took care of my mom for many years. She had Alzheimer's and actually ended up doing okay in the long run, but it was get recognizing it was difficult. She lived in upstate New York, and I'd go to visit her. Her husband had died, and she did have some hearing loss, and I think it all contributed. And she lived alone. She isolated herself, and I'd go up there to spend some time with her, a weekend or a long week, and she'd be miserable. She'd be yelling at me, and she was so angry, and I didn't recognize that these were probably the beginnings of Alzheimer's. I just thought she was always mad at me for some reason. And finally, it started to click in. And, I noticed that she wasn't taking her medicines and she was, what hit me was I got a call from her one December and she said, I don't have any oil. I don't have any heating oil. And I said, what do you mean you don't have? She said, I just don't have any. So I called up the company and I was ready to, light into them. And they said, your mother hasn't paid the bill in 3 months. So that's when I knew that we were in trouble. And so I paid the bill right there. They put the oil in that day. But then I started figuring out what we were going to do about it. And it was very gradated stages of managing her care. And I couldn't do it. I was working from here in Maryland. So I used various opportunities, like something like a place for mom, or help mom home instead or something like that. So I had somebody come in and that worked. That was a very good transition thing. That worked for almost a year. Somebody would come and say, hey Barbara, I'm your friend. Let's chat a little bit today. And she would make her brownies and she was there for 6 hours a day until my brother could stop by and make her dinner. So there's a lot of gradation in the care of somebody with Alzheimer's. Finally, I ended up getting her in a place, Brook Grove here in Olney, Maryland, and that was a godsend. It was not only they took whatever income she had, and it was kind of, I don't know, I guess you'd call it it was kind of a charity type thing. She had to qualify for it, but she did, and that was the best care she ever had. I mean, she lived there for 7 years. They did arts and crafts, they did music every day, and she actually had a pretty good life there, with a lot of care and a lot of good caregivers. But it was extremely burdensome, the whole journey. And I mean, I can advise people who go through it now to get help earlier rather than later, but it was probably the hardest thing I've done in my life.
John, John,
I agree, Patty. Everything you said was what I went through. Uh, I went past my mom's one day, and all of her medicine was in the drawer. All of her pills were just in a box, all of them. None of them were in the pill container, so I didn't know one pill from the other. So, in other words, she had stopped taking her medication. Uh, it looked like, as thorough and meticulous as she was, she got to a certain point. I remember it was in February, where all of her record keeping just stopped. She stopped paying bills. Uh, Electricity, the water, the gas, all of them were getting ready to be cut off. And also experienced that anger you were talking about, because sundowning, like
Yep.
about 4 o'clock in the afternoon, she would go through like a Dr. Jekyll, syndrome. I mean, she never cussed at me my whole life, and until this happened, and it really shocked me because she was not that kind of person at all. But I also remember uh, one day she got mad, and I said, "Okay, Mom, I'm gonna see you later." I took a walk. I got halfway around the block and came back to the house, and came in. This is about 5 minutes later, and she says, "Oh, hi, Johnny. What are
Yeah.
you doing here?" You know, she forgot all about whatever was going on. Uh, I also used the a place for mom. They were excellent. They were totally great. But also I used uh, this place right up the street from here that had help for caregivers because caregivers need support as well. Um, it was actually right up the street from here. I'm spacing on the name right now. Senior Services, but they uh, they had help where you could bring the memory. It was a memory loss group,
Mhm.
and so they had caregivers and the memory loss people meeting together. It was very very interesting and quite rewarding. But Alzheimer's is a slow motion train wreck, and you see it coming, but there's nothing you can do about it. It's coming. Thanks.
Betty Blaylock.
Yes. I think we all, if we've had parents that had Alzheimer's, we all have our own stories. But I want to, well, inject a little humor. Um, you know, as years ago, we didn't have institutions in different places to send our parents once we realized they were having a problem. So in listening to you guys talk, I remembered that one of the pastors at my church, um, when he had passed and the wife was still living, um, she ended up going from her children, one child to the other child, rather than just one child taking care of her. So I guess where the humor comes in is they had 13 children. So she had no problem because they took their time and each one took a turn taking care of their mom. And so I guess what I'm saying is maybe we as uh, married couples need to have a few more children. So when the time comes that we need to be taken care of, there's plenty help there.
Okay, Darryl.
Okay, when a baby's upset, you can't talk at them, but you can sure sing to them, and lullabies will soothe them and calm them down. Alzheimer's patients are just big babies.
They are.
And so, what's very beneficial says yes, singing can be beneficial activity for individuals with Alzheimer's disease and other forms of dementia. Doesn't matter if you're singing along with them their favorite songs or you're singing to them, it'll calm them down. So that's something to think about in dealing with Alzheimer's patients. Um, and just taking it a step further, okay, well, one of the reasons why it does calm down babies or adults because the positive emotions with singing produce endorphins in both the listener and the singer. That's why endorphins are the feel good hormones, and that's why we said at the beginning of the conversation that singing was so beneficial, whether you're a good singer or not. Uh, so, just because it's such a feel good, positive thing, I'm going to try it with my wife and I. We're both singers. We're going to take a day where we don't talk at each other. We just sing everything we want to say. It's going to be like a reality show opera. And we're just going to sing and feel good and see how that works. So I'll report back next week how that works.
Thanks for sharing. Heard it all now. Okay, thank you for sharing, everyone. Let's go to the next article, please. Well, this is interesting because medical misogyny. Misogyny is people who uh, don't like women, or they prefer to deal with men. And this is about a lady who presented with fatigue, and we talked about the mental health aspect, and most of us wouldn't think of post-traumatic stress disorder as being the differential diagnosis. But uh, when you have a woman involved, this is something that should be in the differential diagnosis. And this article points out that often we don't recognize something that has been part of the conversation today, that mental health issues are often part of a lot of what's going on. And if you don't think about it and recognize it, then you don't appreciate it or actually take full advantage of the treatment of the modality or whatever the disease is. And in this case, the mental health disorder was post-traumatic stress disorder, which you don't think that often about women, but they often are the source of much stress from so many sources, from their partner to you name it. Uh, Especially if you come from our area where there's so much uh, shooting and traumatic episodes that they're exposed to. And so it becomes important to keep that in your differential diagnosis, uh, whether it's male or female, but especially if it's a female. And that's what this article is pointing out, that often we're so male dominated that we tend not to think of the mental health disorders that involve, as many of you already mentioned, so many disease entities. Any comments on this? Uh, you think this is going too far in terms of the mental health issues that women face?
I
That
think it should be sent out to all primary physicians. These days, they seem to just want to check the boxes to get their reimbursement. And it, I think there's a lot going on with people these days, and it's not all psychological. It may not all be physical, but I think I don't think we take care of patients appropriately maybe anymore. We just want to get them in and out. Just my thought.
any other comments? Uh, Probably very few people in this group would disagree with you, though, Patty. Uh, and Darryl.
Yeah, that's why it's important to try to have a friendship with your doctor, especially your primary care doctor. If they like you, they'll treat you better.
You're right. No, you're right.
Okay, Dr. Perez.
Touche. Touche, touche. Because you look at everything, it has to be a partnership with your primary care provider, working for this good goal. And I think that relationship has been so destroyed by our healthcare system that we need to demand better. And we can see the impact that it's having. It's right before us. And we are not powerless.
Thank you for sharing. Any other comments? If not, I think we can go through one more article. Oh, they now have, Merck now has a cholesterol pill that apparently is very good at lowering the cholesterol level, which of course, uh, hypercholesterolemia leads to arteriosclerosis, which leads to strokes and other conditions, heart disease, strokes, kidney disease. And so having another drug that actually reduces the LDL levels is something that's very important. And this uh, looms large in terms of there are some people who, in spite of their efforts at decreasing cholesterol intake still have high cholesterol levels. And the high cholesterol levels cause arteriosclerosis, and they cause heart disease and uh, heart attacks. And so lowering the lipid level becomes important. And it brings up the point of what you should know about yourself. You should know your glucose level, you should know your cholesterol level, you should know your kidney function level, your creatinine level, uh, and you should therefore uh, recognize that the most important part of the healthcare team is actually, and the central point of the healthcare team is the patient. And so you have a responsibility to know uh, what kind of lab results you have. What is your cholesterol level? What is your hemoglobin A1C? What is your hemoglobin level? And I think all of this helps you to become a better patient and helps the doctor become a better partner in your healthcare.
Dr. Callender, can I add a note here? My dad had a mild heart attack when he was in his late 60s, and he went to the doctor, and the doctor put him on a statin and told him not to eat red meat and to, be more careful of his diet, just to stick with chicken or fish or things like that. So my father did that. He went back to the doctor like 10, well, every year, but by the 10th year he went back, he was anemic. And the doctor said, Charlie, you're really pretty anemic. Do you eat any red meat? And my father said, well, you told me not to, so I haven't. And he goes, you for 10 years you haven't? No, my father didn't eat hamburger or steak for 10 years. So he said, okay, well, I think it's maybe time that you throw in a steak once in a while. So my father was very happy to hear that. But my father has complete faith in his doctors. He does exactly what they tell him to do. He still goes to the same primary doctor, and he won't. I said his cholesterol is now like below normal. And I said, well, Dad, you don't need this cholesterol medicine anymore. And he's good. I'm not going to stop taking it. The doctor prescribed it, and that's what I'm going to do. So, I mean, my point here is my dad's going to be celebrating his 102 birthday next week. So it pays to follow the doctor's advice and do what you're told to do.
Well, he's fortunate that his doctor's still alive. Darryl.
Okay. Well, I gotta throw in a plug for plant-based diet because when you're anemic, you don't have to go to red meat. You can get all the iron you need from dark leafy greens, nuts, seeds, legumes, whole grains. So you don't red meat isn't the automatic alternative when you're anemic.
Okay, Dr. John Tatum.
Yeah, doctor. I've heard that there is a very useful blood product that you can only get from meat.
Oh, I don't know about that. That you can only get from meat. I'm not aware of that. Darryl, are you aware of
That rumor was put out by the Meat Association of America.
that? Probably. Because they emphasize that protein is not respective of plants or animals, and that you can get all the protein you want from plant products. Now, you may want to say that you can get more of the hemoglobin in some animal products, but the proteins are present in plants as well as meats.
Yeah, they even try to tell you that omega 3s only come from fish oil, but where do the fish get their omega 3? They get it from seaweed.
Hmm. Okay.
Chinese people eat seaweed.
You had a comment, John Tatum?
Yeah, I said that I know some Asian countries where seaweed is part of their diet.
Oh, yeah. Okay. All right. And this will be probably the last article. This is 7 signs you're not getting enough protein. And this is an article that points out that protein is important, that you have trouble building muscle without protein. That goes without saying. And then, of course, exercise, of course, helps build muscles as well. If you don't have enough protein, you can get edema, or swelling, legs, hands, and stomach. Your gums and teeth get weaker. Your mouth gets dry. You're constantly hungry. Your fingernails break, and finally, 7, you have trouble concentrating. It's interesting because I don't think that we have in this country, we have trouble with protein because it's in almost everything that we eat, and drink. So, but in other countries, sometimes we don't appreciate the fact that other countries, they don't have a meal a day and they don't have proteins. And so as a consequence, all of these 7 signs you may see in patients. You've seen those children who have swollen bellies because they don't have enough protein. But it's not as common here in the United States, where in many ways, relatively speaking, protein and fluid food are plentiful compared to what exists in other countries. Any other comments about this article? Finding people in this country who fit in this category is not as easy unless you go into certain populations. Any comments? If not, I think we'll close this. Thanks for all of you who come this holiday, June.